Hello, this is Dr. David Greenee, CEO of the Texas Pain Network. Today's topic is my hip pain coming from a hip or lumbar spine problem? Hip pain is very common. Millions of Americans suffer from arthritis in the hip, and the pain may lead to significant disability and limited ability to walk, exercise. There are close to 300,000 total hips performed each year in the U.S. When pain is occurring in the hip region, it just seems obvious to assume that the problem is coming from the joint. In fact, it may not be coming from the hip joint. There may be an overlap in symptoms between hip arthritis and lumbar spinal stenosis. As we age, spinal stenosis is extremely common, just like arthritis in the hip. Both occur from degeneration, and the presentation of symptoms may overlap. So here's lumbar spinal stenosis. It occurs from degeneration of the disc, which then leads to arthritis in these joints in the back of the spine, whereas normally the spinal canal is nice and elliptical. Here, because of soft tissue and bony overgrowth due to arthritis, you start to get more of a triangle, and as nerve roots try and get out, they can get pinched. The hip pain that is experienced from lumbar spinal stenosis may mimic that of arthritis. So how does a pain management doctor tell between the two? Well, here's an example of spinal stenosis. You can see there's bony overgrowth and arthritis here with tissue coming out into the spinal canal, and then you have disc degeneration with bulging disc going backwards. The two can pinch nerve roots. You can see that right here. Here you have an arthritic hip with minimal joint space. You have cyst noted. You have sclerosis or hardening of the bone. Here you have a normal looking joint space. You see that? So the ways to differentiate between a hip problem and lumbar spinal stenosis, first and foremost, is history. The area of the pain, the duration, when it comes, where it goes. Hip and spine source can cause referred pain down the leg. On physical examination, if you have point tenderness over the hip, then more likely it's hip arthritis. If you have pain with range of motion of the hip, more commonly it's going to be hip arthritis. A neurologic exam is not very helpful. Imaging studies can be very helpful. This is an MRI, a slice where you see the disc in the spinal canal. You see how triangular it is? Okay, it's spinal stenosis. Here you can see that again, thick and soft tissue, degenerative arthrosis of the facet joints, and a triangular appearance in the canal. In the imaging studies of the pelvis, there's that x-ray again showing an arthritic hip. So just because you see it like this doesn't mean that it's always going to be a painful hip, okay? But it does look towards that. Now, diagnostic injection. If you get an injection into your hip of numbing medicine and steroid, it should decrease the pain within a few minutes, okay? Epidural injections in the spine may not work well the first time. You may need a series of injections for optimal relief. So the outcomes of the workup may be, if you do an injection into the hip and you get complete hip relief, it's a hip problem. Okay, that just stands to reason. If you do an epidural injection into the areas that have spinal stenosis and you get complete hip relief, then it's a lumbar spinal stenosis problem. All right. If you get some relief from a hip injection, with the relief from the rest of the pain with an epidural injection, you're most likely dealing with a combination of the two problems, hip arthritis and lumbar spinal stenosis. And then there's always the possibility that neither injection will work. In that case, the investigation continues. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and offering over 25 treatment options. The average success rates exceed 90% with the board-certified award-winning doctors. Visit us online today at texaspainnetwork.net, and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Greenee with the Texas Pain Network. Your pain stops here.